Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center. Here with the beautiful lady Lisa from Melbourne. And the reason why we're doing this video is actually when I got here today, you actually gave me a painting that you had done. It's a mangrove scene. And you put on here, and then there was light through the long journey of pain. Thank you, Dr. Hauser and the Caring Medical team. So thank you so much for that.
Thank you.
Are you a painter? Are you an artist, or?
Yes, I was trained as an illustrator and a graphic designer, and then I got into instructional design. So that's my background, is in illustration and art. Mm-hmm.
Are you still doing that, or do you still do that, or you're retired?
I still do that.
Okay.
I do. Mm-hmm.
And then what caused you to end up, coming all the way over here for care, in Fort Myers, Florida? Like, how did you? What's your journey to end up here?
My journey was I've had about 20 years of chronic neck pain, 2 different surgeries, multiple procedures. I've tried everything, acupuncture, 5 rounds of physical therapy, all kinds of things, different tests.
What were your surgeries?
I won't say this right, I'm not a medical person. Minimally invasive surgery in the back that was laminectomy.
Yeah, laminectomy.
Yes, sir. And a foraminectomy and bone debridement to try and help my hand.
So you never had a fusion?
No, I had a synthetic neck disc, the second surgery. Second surgery, because that bought some time, but it still continued to progress. So those were my 2 surgeries.
Okay. So. And then you actually saw some video that made you think maybe you should try prolotherapy, or
most definitely
come over here.
Yeah, I was looking on YouTube, and I had some odd symptoms related, eye issues with the left side, ear. Nothing seemed quite right after the surgeries, and I found the Hauser Neck Center, and I kept looking at the different videos, and I found your website, saw some of the history that you have posted, different articles, and I'm like, I want to go. I want to be evaluated and go. So
your overwhelming thing though was horrific neck stiffness and pain, and then you really couldn't move your neck, right?
Yes, I couldn't move my neck. Very limited mobility. I couldn't lift my neck up. I couldn't shop and look at high things up, left or right. I couldn't feel my foot when I turned my leg a certain way. Just things like that. Yeah, a lot of mobility.
Did they ever tell you that your lack of mobility was from arthritis? Or no?
No.
Okay.
No.
Because a lot of people, the doctor says that, and that may or may not be correct. From my standpoint, especially if you have clicking, popping, grinding in the neck, did you have that?
Yes, I had that. Mm-hmm.
So anybody who has clicking, popping, grinding of a joint, and then they have restriction of motion, it's likely the muscles are clamping down because of instability. Mm-hmm. So then your neck's loose, but you have restriction of motion. It almost seems like the opposite. And then when you get prolotherapy to tighten it, you actually regain the motion. Mm-hmm. So tell us about your journey with prolotherapy. How are you doing?
I'm doing fantastic, and it makes me want to cry because it's such a life-changing experience. From the first treatment on, the first treatment I had within 2 weeks, I actually woke up and I realized I had no pain. Mm-hmm. It was just, I didn't know what it was like to not have pain, having lived with pain for so long. Mm-hmm. And then from every treatment, I started noticing I can move my neck up. I can move my neck this way. I couldn't do that. I could also just simple things. And, the different diagnoses you gave me, the different tests, I had answers, and it was just life-changing. And even my best friend who's with me today, it's people say I'm a different person.
Oh, great.
The old me is back.
Good.
And that's why I painted. I haven't painted in a very long time.
Oh, I didn't know that.
I paint, I used to paint all the time, but it's painting was uncomfortable. And I'm like,
okay.
Something called me to paint that for you, and it's I need to do that.
That's awesome. Wow, that's fantastic. Probably your energy's a lot better.
It's a lot better.
And then the brain fog goes away. Or why don't you go through, because you did have some other symptoms. Why don't you just go through the other symptoms that maybe when you watched the videos that I made, it put it all together that these other symptoms beside pain could also be the neck. Like you said, what was going on with your eye or your vision, and then tell us about your other symptoms.
Most definitely. So I had problems with the left eye. I went to ophthalmologist. They did different tests, but there was just something that I'd see weird, sometimes a shape, like an after shape, and sometimes
They're called after images.
Yes, sir.
After
Yeah.
images.
So
like you look at something and then something's still there.
Exactly.
Yeah, after images.
So I would see that. Many times when I turn my head, and I didn't know this, and now I'm cognizant of it. If I turn my head to the left and look down, I couldn't feel my foot.
Okay.
And I had some balance.
Can you do that now?
I can.
Okay.
Yeah,
good.
and I'm much more cautious around, well, not cautious, but cognizant of like my posture and things I can do to continue to improve.
Yeah.
But just odd symptoms like that. My ear all this was popping, making weird noises, just bizarre things. And once I started doing the draining of the brain exercises and using the Denerol, it's like
Went away.
it went away, and I could actually feel it like going away the first few
the fluid
times.
goes out of it. Yeah. Did you any heart palpitations or anxiety or personality changes, swallowing problems or not?
A little bit of swallowing problems. Yeah, I had some swallowing. It's resolved.
And then the stomach or the digestion, any issues with that, or that was all good?
No, didn't have that.
Sounds like it was mostly your left side.
Yes, sir.
Okay. We always talk about, or I've talked about it before, the gift of health. So like when you've been sick for so long, and your case is a good example of like, there actually always is a reason for a symptom. So even if you've had a symptom for 20 years, if you get at the root cause of it and you correct it, I mean, it has the potential to go away. Because, some people probably give up, right? Like, why do you think you never gave up?
Probably in my heart, I knew that there was some simple reason, and I don't mean to minimize that, but there was a reason why this was happening, and it was somehow connected. I'm not a medical person, but I knew there was something, there was an answer, and it was connected. And I just wasn't, through all the processes I went through, healthcare providers, I just wasn't getting the right message or answer. Maybe they didn't know. That's what I really feel. That's why I didn't want to give up.
They just didn't know.
They didn't know.
Yeah. Now, what I was alluding to before was the gift of health. So what do you think you're going to do with your gift of health? Like, what do you see for your future now that you're healthy?
Now that I'm healthy, I definitely, people who know me, they know that I'm a different person. I'm the old Lisa that they knew years ago. I want to do more art, paint.
Okay.
I want to do different things with the years I have left.
Like, what would you like to do?
I like to be more outside, do more activities I used to do, hiking, just being engaged with swimming more, a lot of things that I used to really enjoy, snorkeling, I had to kind of put those on pause or hem them in. I want to do something different with my career. So.
You love the water.
Yes, I do.
I wish more people around the globe swam, because I've often said I think the very best exercise in the world is swimming, because I never knew how to swim, but I learned how to swim as an adult. Like, you can learn how to swim as an adult, and obviously I wouldn't know when I learned how to swim that eventually I would live in Florida, but it's because it's a core workout. You go through the full range of motion of all your joints. It's non-weight bearing, and when we talk about you just need to be active, well, you can move all the joints with swimming. Are you by some place that has good snorkeling, or you have to travel from Melbourne, or does Melbourne have some good places to snorkel?
I probably not have to travel.
Okay.
I like to see the bottom of the water. So.
Yeah, where would you travel to go snorkeling?
Probably the springs near Gainesville, where it's a little more clear.
Okay.
That's a good area. And then they've got some springs in Orlando that they're pretty clear.
Okay.
So.
I didn't know there was springs in Gainesville.
Oh yeah, they're beautiful. They've got Ginny Springs. There's a lot of high springs, those areas around there that were traditional springs from the 1800s for tourists. But they're beautiful. Ginny Springs is where a lot of people do. I did my open water certification.
Oh,
there.
you did?
Yeah, they did some
Ginny
things.
Springs in Gainesville.
Yeah, there's some very pretty areas.
Okay, then in the center of the state, where do you go?
Well, I know there's Wekiva Springs near Orlando. That's nice.
Okay.
Kelly Springs.
Okay.
And they're really beautiful, cool
I've been
water.
to Crystal River.
Crystal River's gorgeous. Yeah,
been to Crystal River.
Yeah.
But thank you so much. We're
Thank
so
you.
excited for you.
I'm so thankful that I found you in the clinic. I really genuinely mean that. It changed my life. Really did.
Thank you so much.